Presidential hopeful Bernie Sanders is now back home in Vermont, recovering from a heart attack and stent procedure. It led to a lot of talk about the procedure and how it's different from a full bypass. Joining us today is TriHealth cardiologist Dr. Jon Hassel, and he's here to walk us through both procedures to better understand the risks. Thank you so much for being here, Dr. Jon.
You're welcome.
So, what are the symptoms of a heart attack?
So most commonly people feel what we call angina, which is center chest tightness. It's worse when you're doing something and better with rest. In a heart attack setting, it will usually not be relieving. It will go on and on. When you're having kind of stable angina, it's more like a 5 to 15 minute kind of symptom. People may also have nausea and vomiting, and pain to their jaw or left arm is very common as well.
So who's most at risk for a heart attack?
So heart disease is the #1 cause of death. As you get older, it becomes more common. Some of that's family history, smoking, high blood pressure, high cholesterol, and diabetes are the things that lead to it.
Now, Dr. Jon, I've seen all the commercials, the aspirin commercials, and they say a low-dose aspirin could possibly prevent a heart attack. Is that still true? Has that changed in recent years? What's going on with that?
In certain high-risk people, it does help prevent it. It's something we used to give it to all patients over 50 years old. Now it's reserved for people with coronary artery disease or stroke, but it does help prevent future heart attacks in those people.
And so we were talking about the stent procedure. What exactly is that?
So that's what I do. I'm an interventional cardiologist. That's where we go in with a long, thin plastic tube called a catheter. You either go in from the groin area or from the wrist, and you go up to the heart to take pictures of the arteries of the heart. And then if you see the blockage, you open it up with usually a balloon first, and then the stent is a piece of metal mesh that goes in to keep the artery open.
Well, doctor, my last question, what kind of advice do you give to people to keep their heart healthy?
Well, you want to control those conditions that I mentioned for sure. If you're diabetic or have high blood pressure, high cholesterol, you want to keep all of that under control, not smoke, stay active. And if you have the symptoms, don't ignore it. If you're having chest pain, you should see your primary care doctor or come see us at TriHealth Heart Institute. We'd be happy to talk to you more and work up what's going on.
Well, Dr. Hassel, thank you so much for being here.
You're welcome. Thank you.
Well, remember, the answers you hear from our TriHealth experts are just a good place to start. This is not a replacement for advice from your own doctor. Please send us your medical questions, and a TriHealth doctor will answer it live on the air next Tuesday. Just look for a link at wcpo.com/doc-on-call to submit your question. We will answer one question every Tuesday. Stay with us. We'll be right back.